Welcome back. Today we're going to focus on the core skills of motivational interviewing. These are known as the OARS of motivational interviewing. OARS, O-A-R-S. These skills are the tools we use to navigate conversations, allowing our patients to safely open up and become more receptive to change. Let's explore each one of these skills and see how they empower both patients and you as a healthcare provider or first responder on the journey towards positive change. First, we're going to look at open-ended questions. These are questions that cannot be answered with a simple yes or no. They encourage patients to share more about their experiences, feelings, concerns, and challenges. Now let's spend a few minutes reviewing this concept in practice and see how we can apply open-ended questions in our everyday practices. Now, we're going to start by considering a client who is struggling with alcohol use disorder. A first responder may have historically asked this person, "How many drinks do you have at a typical day?" Or, "Are you an alcoholic?" Instead, I would encourage you to consider asking a question like this. Can you tell me about your relationship with alcohol? Now consider the two types of questions. I think we can understand that the first one could put someone on the defensive and cause them to withdraw from the conversation, whereas the second one solicits a meaningful answer from the client and makes them feel like you actually care and you want to hear the challenges that they're going through. Next, we're going to look at clients struggling with substance use disorder. Historically, a first responder might have asked a question such as, "Have you been in trouble for using drugs before?" When you ask a question in that nature, you can actually create stigma, negative stigma, around substance use disorder. It's important for us to check our own biases. It's important for us to understand that substance use disorder is a medical condition like any other medical condition. And the way we ask the question can convey how we feel about substance use disorder. And if we ask the question in an accusatory manner, that stimulates negative stigma across the community. And it tells persons experiencing substance use disorder that myself as a provider, myself as a first responder, my organization that I work for, my community that I represent, my culture of first responders in the community believes that substance use disorder could potentially be a moral failing and not a medical condition. And we just simply know from evidence now that that's not true. It's a medical condition no different than cancer, no different than heart disease. And if we treat it the same, if we treat it effectively like a medical condition, we stand a much greater chance for having success. So I would encourage you to ask the question in a different manner. Consider asking the question this way. What challenges have you had related to your substance use disorder? Asking the question this way allows us to come alongside the client and learn with them. It accepts their autonomy and it acknowledges that they are the experts in their current situation and that we're there to support them. When working through behavioral challenges, we should avoid questions like, "Are your family and friends afraid of you because of your violent behaviors?" And instead, we could consider asking the question using less judgmental language. How has your anger or aggression impacted your relationship with your friends and your family? I genuinely want to know. Because once we start a conversation, once I ask them a question that can't be answered with a simple yes or a simple no, I can use my non-verbal skills to show them that I'm hearing what they say. And that is so important. As a provider, we want to stay away from aggressive statements like, do you want to lose your job for not showing up when you're supposed to be at work? And instead, guide them to draw out possible consequences on their own, such as, how is your job performance impacted by the number of times you've been late or been forced to call off? So another great way to form an open-ended question is to start with this catchphrase. Can you please tell me more about? And then go in with an inquisitive mindset about what you want to learn more about. Open-ended questions invite exploration, giving the client a safe space for deeper reflection into their own cognitive dissonance or discrepancies. These questions should be free of accusations and blame. I understand that this is not always easy. We have to check our own biases. If we fail to do so, then we fail to be genuine. And if we fail to be genuine, the client will see. Next, let's talk about affirmations. Affirmations are positive statements that recognize a client's strengths and efforts. Remember, change is hard. We all like to be recognized for the hard work that we do. If somebody is taking steps towards addressing a challenge or a concern, the best thing we can do is help recharge their internal batteries by letting them know that we see the work that they're putting in, and this helps them remember the hard work that they've done to get to where they're at. Affirmations build confidence and support a client's belief in their own ability to accomplish change. Examples of affirmations include, it must have been really hard to share with me today. I am glad you trusted me enough to do so. Thank you. You have set a good example for others by reaching out for help today. It has been a while since you have had to call. You must be taking some real positive steps in addressing your challenges. Do you see how those affirmations build on small successes? And when we reinforce those small successes, it empowers the client to reach for ever greater opportunities for change. Affirmations are powerful. They validate the client's struggles and their achievements. This fosters a supportive atmosphere, and it develops and it solidifies rapport. We can't influence change in a person's life until we have rapport. These must be genuine affirmations. False affirmations harm the development of rapport and damage the client's self-esteem. People smell BS. If you can't say it honestly and truthfully, then don't say it at all. Because if you try to fake it, they're gonna know. Reflective listening is our third skill. And it's about truly hearing what the client says and reflecting it back to them, showing that we understand and empathize with their situation. This is so important because it has two different positive aspects related to it. The first one is it allows a potentially marginalized person to know that someone in your position cared enough to listen to what they said, and to understand what they said. The second one is it helps ensure that we understood what they said and that we didn't misunderstand what they said. So often in communications, one person is talking and the message that is received isn't exactly what the other person meant to say. When we repeat or paraphrase a statement back to the other individual, we can confirm that what we think we heard is what we actually heard. This makes for profoundly more effective communications. Examples of reflections include, so your kids are very important to you, and you feel your substance use is harming your relationship with them. So what we've done is we've taken what the client has told us over the last several minutes and we've paraphrased it and made sure that we heard what they said. Another example, based on what you've told me, you feel your drinking has endangered the people you work with, and you would like to do things differently moving forward. This is a very powerful reflection because not only does it let the client know that you heard what they said, but it also engages early signs of change behavior. They have a desire to do something different. They have stated where they are and where that gap is between where they are and where they want to be. We can work with that. Another example, what I hear you saying is that if you make some small changes in regards to your health, you might have more energy and be able to accomplish what you would like to do. Again, very powerful. We're tying their behavior, they're tying their behavior into their desires and how changing their behavior can help them accomplish their desires. And by rephrasing, reshaping, and helping them see that, you're reinforcing what they've already told you. Reflective listening builds trust and shows the client they were heard and ensures you truly understood what they said. It is not repeating what they said. We are not birds that are just repeating what was said. We are actually showing the client that we heard what they were saying and we think we understand the meaning. And this gives the client an opportunity to correct any misconceptions we might have had, or to reaffirm that yes, what we heard is what they meant to say. Effective reflections require active listening, which means listening to understand the person and to understand what they are telling you without thinking about how you're going to respond. This is sometimes difficult to do. Make sure that when a client is talking, you're in the moment with them. You're taking the time to look at their body language. You're taking the time to look at their facial reflections. You're listening to the inflections in their voice. And you're trying to truly understand not only what's coming from their mouth, but what's coming from their heart. That is when you will truly be able to understand what a person is conveying to you. This is such an important piece to developing a rapport with a patient or a client. Now, you will not always get it right, but that's okay. You know what? Actually, it's better than okay. Because getting it wrong affords the client an opportunity to be empowered. It gives them a chance to tell you, you know what, no, that's not what I meant. It empowers them to stand up and say, no, what I actually meant was. Or, no, you didn't get it right. Could you try again? And then that affords you the opportunity to have a second chance. You know what? When you get it wrong, apologize and ask the patient to restate the thought or idea. Then attempt the reflection again. The last thing we're going to look at today is summaries. This skill involves pulling together many of the reflections in one main idea, reflecting back the key points and ensuring you understood what the patient was attempting to convey. Remember, when people are under stress or they're in crisis, they may say things and not fully understand their thought, idea, or concept on their own. Reflecting the different ideas that they've brought together in the conversation can help them see points that they were missing. This is very, very powerful. Summaries help to clarify and focus the discussion. It sets the stage for moving forward beyond ambivalence towards making long-term meaningful change. Practicing the OARS helps each of us improve these skills. In a moment, I will ask you to pause the video and find a partner to practice the OARS. Spend 5 minutes actively listening to them share concerns or issues they have. Start by asking them open-ended questions about a challenge or an issue they might be willing to discuss with you. Make sure you affirm their willingness to be vulnerable in this moment with you. That is a real sign of trust. Please acknowledge that. After each idea they share, try to verbally reflect on the idea they shared to ensure you understood what they were saying. End the session with a summary, including the main points and how they feel about these issues. Please pause the video now and practice. And welcome back. How did that go? What was easy for you? What should you keep working on? Did you try to give advice or fix a problem? As caregivers and first responders, it is very natural for us to want to fix a person or solve a problem. But remember, at this stage, it is about developing rapport. When we try to give advice while we should be listening, we take our eyes off the ball. This can leave a person feeling unheard, unappreciated, or misunderstood. We must avoid the fixing reflex that exists in all of us. The goal here is to empower the patient through intrinsic motivation, which is far more powerful than telling them extrinsically how they should fix their problem. I would like you to pause the video now and watch the video. It's not about the nail. Welcome back. Man, that is a really powerful video, isn't it? Just remember, by leveraging the OARS of motivational interviewing, you equip yourself with a versatile toolkit for guiding conversations in a way that motivates and empowers others. These skills are the essence of motivational interviewing and can transform your interactions with patients, leading to a meaningful and lasting change. The OARS skills are the hardest to master, but the most important part of motivational interviewing. Purposeful practice over time will prevent poor performance. At the end of the day, it is about being there with the person. Utilizing the OARS, even if you have not mastered the skill, will show the client you care. Over time, you will see how even small adjustments in your approach can have big impacts on your client's journey towards health and wellness. Thank you for allowing our team to join you today. Next time, we're going to look at practical examples of how to apply these skills in real-world scenarios. Until then, good luck and good health. Thank you.